but it's clearly misinformation. We know so much about the vaccine, how effective it is, how safe it is, who it works in, how long it works. We have the consensus of science.
The mainstream media is once again parroting supposed experts, calling Alberta's recently released COVID-19 review report anti-science and damaging to public health, when in actuality, it's public health that has damaged itself.
Well, anyone who doesn't think that science is a process of point counterpoint and then being able to synthesize information is somebody who doesn't believe in science. So I know there's been a narrative, and a narrative has been enforced by shouting down contrarian voices, and that's not what we're going to do. We're going to listen to every voice.
Experts featured by the Canadian state broadcasters argue that the report contradicts the medical consensus. But isn't that precisely what is needed after nearly 5 years of blindly trusting the science that has resulted in disastrous shadow pandemics, unintended consequences, and lasting damage for those suffering from the fallout of unbalanced, knee-jerk policies driven by hysteria, fear, and emotion rather than grounded in high-quality evidence, balance, and logical reasoning? After all, it was the illusion of consensus that paved the way for the supposed science is settled stance that is, in and of itself, anti-science. The oppressive combination of isolation and government-imposed social media censorship woven into the COVID response gave way to this illusion of consensus. It's the exact same thing that organizations like the Alberta Medical Association are trying to do by bullying their way out of accountability over the way COVID-19 was handled. Here's the kind of rhetoric coming from the experts the mainstream media was able to find to dismiss the 269-page report.
More Albertans are alive today because those measures were taken.
Alberta's former chief medical officer of health is defending measures criticized in a 269-page post-pandemic review released Friday by the province. In 2022, Premier Danielle Smith ordered that the health minister create a panel to examine COVID-19 data. The group's final report makes many recommendations, including to allow for greater flexibility in the use of therapies and halting the use of vaccines without full disclosure of their potential risks, ending their use in healthy children and teenagers.
There is no question that it's safe and it's effective. But more than that, the government and the Minister of Health's refusal to answer this question continues to cause uncertainty.
I actually am really concerned that it will have a really bad effect on public trust.
Dr. Lenora Saxinger has concerns about the quality of the report, which cost taxpayers $2 million.
Given that this report does not have that quality or caliber of information, that I think it should be withdrawn.
It contains misinformation, and we all know that misinformation is a huge problem right now, and people die because of it.
Dr. Shelley Duggan also questions those behind the report.
People who were anti-vaccine all throughout were anti any of the public health measures. So you have a group that is potentially biased.
The report's lead author declined an interview with CTV News, writing, "As far as being anti-vax, there are no grounds for that. I have been vaccinated many times," adding, "Above all, we ask for open scientific debate without an agenda."
Intersecting between science and politics, and that's always dangerous.
Some experts outside the province suggest the views presented are threatening public health.
It's problematic to me that as many as 35% of parents in Canada may no longer believe in vaccination for their children. And this is just not based in fact.
And then there's British Columbia's Chief Medical Officer of Health, Bonnie Henry, who was instrumental in implementing the province's longest standing vaccine mandates, chalking up the entire report to misinformation.
But the political landscape has also shifted. I mean, in Alberta, you have a task force that Premier Danielle Smith commissioned to review Alberta's COVID-19 pandemic response and released its final report. That report was posted on Friday afternoon, and it recommends halting the use of COVID-19 vaccines without full disclosure of their potential risks, and the province to allow physicians to prescribe alternative treatment options for the virus, such as ivermectin and hydroxychloroquine. I mean,
hydroxychloroquine.
Yeah, this is taking us back to, the dark times.
It is, and I think it's very unfortunate. I can see that, perhaps the government was not as enamored of these points of views as they were when they commissioned this report, in that they released it on a Friday afternoon. But it's clearly misinformation. We know so much about the vaccine, how effective it is, how safe it is, who it works in, how long it works. We have the consensus of science.
These bullying and malignment tactics, calling for the dismissal of a well-sourced report based on the illusion of consensus, rather than discussing and debating the merits of the data and the evidence provided, are exactly what have worked to stifle free speech and authentic inquiry since 2020. Facts don't matter if they cannot be discussed, if they cannot withstand scrutiny and investigation. And this paves the way to the fictitious reality where public opinions and thoughts are shaped entirely by government agencies and conflict of interest riddled bureaucracies. On her first comment since this report, this is what Premier Danielle Smith had to say.
Well, I was pleased to see that we had a broad cross-section of doctors able to look at our previous COVID response, identify processes that were in place, identify things that may have gone wrong, identify things that are now under question, like the efficacy of masks and the efficacy of this vaccine in children. And so I think we're going to take a look at that, and obviously we'll make some decisions about whether to move forward on any of the recommendations. But the point of it was to figure out what we do should there be another pandemic that we have to respond to, so that we don't make mistakes that hurt people. So I was pleased that they came forward with a report. I don't have an agenda yet of what we might implement, but I think we always have to make sure that in a world where we care about science, that all voices are heard. That's what science is. You actually hear the different viewpoints so that you can make solid decisions on what you hear. And I think restoring the right of doctors to be able to speak their minds without punishment from their colleges, I think that's going to be important too. Otherwise, politicians will make bad decisions. So this is the kind of approach you should probably expect from me, that I will always seek out contrarian voices just to make sure I make the best decisions.
And your response to the remarks from the large medical associations in our province and our country, basically associations of doctors, saying that you appointed anti-science people and they told the public anti-science things.
Well, anyone who doesn't think that science is a process of point counterpoint and then being able to synthesize information is somebody who doesn't believe in science. So I know there's been a narrative, and a narrative has been enforced by shouting down contrarian voices, and that's not what we're going to do. We're going to listen to every voice, and we're going to make our best assessment based on what we're seeing with the evidence, and the evidence has changed. The information that we've had over time and what we were told at the beginning is a little bit different than what we're hearing today, and so we've got to adjust to that.
As a biomedical authoritarian future threatens to shape society through intrusive legislation and powerful organizations, it is crucial for both medical professionals and everyday citizens to remain vigilant in challenging medical taboos and engaging in open, critical discussions about the pharmaceutical industrial complex. Without such efforts, public opinion risks being manipulated by those with financial interests who undermine free speech and thought. Science thrives on evolution, debate, and scrutiny, and the call for consensus is inherently anti-science. A well-researched, evidence-based report that questions public health policies is not an attack, but a necessary independent perspective in an era where such scrutiny is more important than ever before. For Rebel News, I'm Tamara Ugolini. A key point of the report calls for the halt of the novel modified RNA injections for healthy children. We've been calling on the federal government to do the same at nomoreshots.ca. To support this work and have your voice heard, head on over to that website, sign the petition at nomoreshots.ca.